Ladies and gentlemen, good morning. Good morning, ladies and gentlemen. Thank you very much for your attention. Welcome to our forum today. It's really good to see so many people here. I know it's an issue of great interest across the healthcare system, the challenge of preventing and responding to occupational violence and aggression. So it's good to see so many people here from the senior management and board areas of health services to talk about this very important topic. My name's Heather Wellington and I've been asked by the department to facilitate the forum today. So good to see lots of familiar faces and a few new ones, and I look forward to enjoying the forum with you today. We've got representatives here today from a range of health services across metropolitan and rural Victoria and spanning the public and private sectors. And we've also got representatives from a range of related agencies, including WorkSafe Victoria and the Victorian Managed Insurance Authority. So welcome to all of you from wherever you come from across the system. We're actually live streaming the forum today. We have at the other end of the camera somewhere around 25 to 30 people, I think, who are joining us by video conference, and they'll be able to engage in the forum by sending through questions when we have our discussion time. So welcome to everybody who is joining us by video conference, and just to let everyone know that the forum is being video recorded. I'm sure that won't diminish the discussion that we can have. I'd like to acknowledge the Indigenous owners of the land on which we meet, the Wurundjeri people, and pay my respects to their elders past and present. Everyone's here today because they care about people who work in the healthcare system, and everyone recognises the challenges that this environment throws up for us. I thought that we should, just at the start of the day, particularly acknowledge the terrible events that happened at Eastern Health Service a couple of weeks ago now. I know we've got representatives here from Eastern Health, and particularly the terrible injury sustained by Dr. Patrick Pritzvold-Segman, who was felled by a one-punch assault. And I think it's brought home to everybody the risks that our staff are facing and the challenges for everyone in making this system as safe as we could. And I know that everyone's thoughts in this room and across the whole system over the past couple of weeks will have been with him and his family and the managers and colleagues and staff and people on the board at Eastern Health. So I thought we should just acknowledge that today, that we're all thinking of everyone who's been affected by that. The purpose of today's forum is listed on your agenda. It's about providing you with information about what the Department of Health and Human Services and WorkSafe Victoria, the initiatives that they're undertaking to improve worker safety, particularly in relation to occupational violence and aggression. It's about having some discussion around governance, leadership and risk management, and enhance people's understanding of issues in relation to the very important governance issues from a board member and management perspective. We're going to showcase some strategies that are in place at the moment to reduce and respond to occupational violence, and just provide you with information about the resources and tools that are available to assist health services in this very important task. And we have a range of expert presenters for you today, and I think, I'm sure that you're going to find this forum very interesting and stimulating. Just some housekeeping matters before we proceed with the formal parts of the day. The toilets are out in the foyer at the far end. There'll be refreshments served throughout the day, also in that lovely foyer out there. And if you do need to keep your mobile phones on, please turn them down and feel free to move outside the room if there's anything urgent that you need to attend to. Otherwise, we'd appreciate it if you can keep them at least turned down and preferably turned off for the day. So welcome again, everyone, and we will move into the proceedings for the day. So I'd like to invite Claire Amies, who is from WorkSafe Victoria. She's the Chief Executive Officer, and she's going to make some opening remarks. Thanks, Claire.
Thanks very much and welcome everybody. I'd also like to acknowledge the traditional custodians of the land on which we're meeting and pay my respect to their elders, both past and present, and any elders from Indigenous communities that may be with us here today. I'm really pleased to be here. I didn't get to attend the first forum with CEOs and boards across Victoria of our health services, and it's fantastic the Department of Health and Human Services continues to invite WorkSafe to be a key partner and work with you around some of the issues that many of you are facing right now in your businesses. As you are going to hear throughout the whole day, which is no surprise to you, is our focus on occupational violence and aggression in Victorian health services really being an issue that at the moment is not, although we're aware of it, it's not just about having a conversation. It's really thinking about what action can we take and what can we do differently, but what can we share and learn jointly together about what's the best approach going forward. So for us, it's about really making sure that we understand what occupational violence and aggression as a risk to our workforce looks like in our health services, and what can we do as leaders to ensure that it's better prevented and managed. So I've come from a background working in health for many years before I came to WorkSafe Victoria. So I know the importance, particularly around patient safety and patient care, and the degree of focus that it absolutely and importantly deserves in health services in this state. But we also need to recognise the occupational health and safety is actually linked to patient outcomes. They're not separate priorities. They actually are joint priorities in our organisations. So to maintain the quality of health services, we must protect healthcare providers and workers from violence. If you actually understand and prioritise the safety of your staff, we can almost guarantee that you're leading the way in patient safety as well, because it becomes part of your DNA and your culture. In 2015-16, I chaired the Violence in Healthcare Task Force in Victoria, which provided key advice on actioning the Victorian Government's commitments towards addressing violence in health services. Some aspects of the strategy that came out of the task force, to which we at WorkSafe believe are critical in tackling this issue, are the actions focused on organisational culture. This includes creating an environment where it's safe to speak up about safety and violence and aggression in the workplace, where you work together across employers and employees to find solutions, and that there is a culture that encourages reporting and action is taken. So the Never It's Okay campaign, which you're going to hear more about shortly, is a public campaign. But importantly, the campaign also comes with the tools and resources that aim to make an impact in health services on both reporting and particularly on the culture that you create in your workplace. As employers, the campaign message is clear that occupational violence is a key risk in all health services, and we have to do more to prevent it. This does require leadership across the board, and that's why all of you are here today and that you actually signed up to attend. So we actually are seeing that over time there is a real shift in focus, and it's not that you haven't recognised this as a key risk, but there's a change in the focus around we don't respond to it after it's happened. In the morning when I came in talking to a few people, we've always been great on the debriefing and the activities that happen after an event occurs, but our most important role is to actually prevent people being injured or being attacked in the workplace. We need to make sure that we're having the right conversations and the issue is being treated with the seriousness it deserves. And as I said, the mere fact that you're here today says to everyone that it is absolutely a priority for you. There are many players in this space, and we recognise that all of us are trying to work towards a common goal. So it's important to hear all of those voices and understand where everybody's coming from. The Never Okay campaign is one example of a close collaboration between WorkSafe and the Department of Health and Human Services. So importantly, the contributions for the campaign and the development have come through collaboration and a variety of stakeholders across the sector, including employees. Clearly, this demonstrates that we're moving in the same and what we believe is the right direction. But beyond the campaign, WorkSafe Victoria is expected, and we are playing a very vital part in what we can do to help you further. Our inspectors are visiting your workplaces to provide not only education and encouragement, but also to enforce compliance. We're also doing further research and working with research partners to better understand occupational violence and aggression in the sector. This will help us, in consultation with you, around the future resources that we need to develop, but importantly, the tools that you are going to need. You're soon going to hear from Marnie Williams, who's our Executive Director of Health and Safety at WorkSafe, and Marnie's going to speak to you in more detail as leaders and employers around what it is that you need to do to better identify and manage occupational violence and aggression as a risk. As individuals, you're all governing and leading health services. And as much as this requires you to be asking the right questions of your people, it also means that you need to know that you're receiving the right information, that you need to understand your business, so that you're confident on how well you really understand the impact of occupational violence and aggression and what impact it has not only on individuals but as your organisation as a whole. Understanding the risk that it represents in different locations, but importantly, what is your management and your workplace doing to manage this risk? You need to understand your specific environment and your workplace and act on it and keep re-evaluating what you're doing, never thinking that you've nailed it, you've got the answer, but constantly learning and making sure that you're mitigating risks. Occupational violence and aggression is something that is not separate from your broader occupational health and safety risks. It's also not separate from your everyday business risks. It's a key corporate risk, and it should be discussed on a regular basis with all risks and how you're managing them in the boardroom. So whilst there's no two health services that we recognise, or sites, or workplaces, or wards that are exactly the same, we are facing the same challenge. And by working together and talking together, that we actually will be learning more about what's possible and how we can translate that back into our workplace. So I hope and I ask that you take advantage of this forum, take the opportunity to learn, absolutely ask questions, network at the breaks particularly, and stay connected post this forum. Today, I also hope that you'll understand a little bit more what WorkSafe's doing and, importantly, what the Department of Health and Human Services are doing to support you and assist you in this journey. Regardless of any of the circumstances in any workplace, violence and aggression is never accepted. It's never okay. Thank you, and I hope you enjoy the day.
Thanks very much, Claire, for those opening remarks and for the support that WorkSafe Victoria is offering to the sector. So people would be aware that there is a new awareness campaign that has been launched, and we're going to hear a little bit more about that today. I'd like to invite Patrice Wallace. Patrice is the manager of the health practice at WorkSafe Victoria, to come up, along with Janelle Hearn, who's the manager of worker health and wellbeing at the Department of Health and Human Services. And Patrice and Janelle are going to tell us a little bit more about the Occupational Violence and Aggression Awareness Campaign, It's Never Okay. So thank you, Patrice and Janelle.
Thanks, Heather, and thanks, Claire, for the opening. I would also like to acknowledge the traditional owners of the land on which we meet today, and the Wurundjeri people, and pay my respects to elders past and present and any who might be with us today. Janelle and I are going to start the day by showcasing the Occupational Violence and Aggression campaign that launched last week. Many of you will have already received some communication around the campaign and may have already seen the ads on TV. We thought it'd be a great opportunity today to take you through how the campaign came about and the process we went through to get it to the final product that it is today, of which we're really proud. And we're hoping that's going to have a really significant impact. This is the first time that the Department and Ambulance Victoria and WorkSafe have worked together on a campaign like this, and it's been a really successful collaboration. How do I do this? So we know, by way of background, we know that OVA in healthcare is a major occupational health and safety risk. The research suggests that up to 95% of healthcare workers have experienced it, but only 1 in 5 or 20% report it. OVA claims in healthcare are on the rise. In 2005, 18% of all OVA claims were from healthcare workers, and in 2014 that increased to 25%. We also know that healthcare workers are 4.7 times more likely to submit an OVA claim than other workers. And of course there was the recommendation from the 2015 Victoria Auditor General's report into occupational violence in healthcare that said that WorkSafe, the Department of Health and Ambulance should work together to develop appropriate public messaging to increase awareness of the issue and also the need for appropriate and respectful behaviour towards healthcare workers. So thus the campaign begins. So throughout the development of the process, we've undertaken significant stakeholder consultation. We used two key groups of stakeholders for this consultation, the Department of Health's Violence in Healthcare Reference Group and the WorkSafe Health Practice Stakeholder Working Group. There's a broad range of expertise involved in these, across these stakeholders, including health services, executives, managers and workers, unions and other employee representatives. They've been involved from the very beginning, from providing initial insights into the problem, along with helping to develop the campaign objectives, the creative concept and the TV ads, and also reviewing and development of all the other campaign and communication materials. So we're confident we've got a really great product thanks to the insights and input from all the stakeholders that we've involved along the way. As with any WorkSafe campaign, extensive research was undertaken prior to the event, prior to even beginning development of the campaign. It takes a long time to develop one of these campaigns, more than a year it's been going on. So the way this starts, one more. Sorry. So the way it starts is we at WorkSafe engaged our research partner, ISCAR, the Institute of Safety, Compensation and Recovery Research, to conduct a literature review and data analysis to really understand what was going on. And some of that data I just talked about before has come out of that. And then, as I've already said, we involved the stakeholders with initial meetings, and there was some market research, in-depth interviews that occurred with healthcare workers and the community. All of this gets put together and we come up with a campaign model and the objectives, which I'll take you through in a minute. So the campaign research identified that there's a spectrum of violence and aggression that occurs from the lower levels of aggression like eye rolling, sneering, through yelling, intimidation, up to the physical end of the spectrum, including biting, scratching, pushing, punching and strangulation. And I'm sure all of you have heard about incidents across the spectrum in your health services. Whilst it's obvious that the effects of the more extreme acts have on people, it is important to note that the cumulative effects of the behaviours at the lower end of the spectrum can have a significant impact on people's health and wellbeing as well. So for the campaign, we want the general public, as well as the healthcare workers and employers, to believe that none of this behaviour is acceptable, not just the behaviour at the extreme ends of the spectrum. The other thing that came out of the research was the acceptance continuum. So we know that at one end, people with dementia, mental health issues, and even those affected by drug and alcohol, that occupational violence and aggression is more accepted from people like that. But at the other end, where it's much less likely to be accepted from people who are just being aggressive to get what they want. So it was identified that the greatest opportunity to shift attitudes and change behaviour in the campaign was in the person under stress scenario. And this is what you'll see, if any of you have seen the ads, and we'll show them to you in a minute, is where the TV ads have been focused on. Preventing OVA across the board is, however, critical, and that is covered in all the other more detailed messaging and tools that are provided as part of the campaign. Just a quick idea to tell you from the focus groups some of the things that were being said by each of the groups. From the community, the community was really saying, people who commit OVA are not like me, this stuff doesn't happen that often, and getting yelled at isn't that bad, so just ignore it. From workers, they were saying, well, it's kind of part of the job, we accept it as part of the job. We need to look after the patient first. Patient care and patient safety is the most important thing. And reporting it's too hard, and even if we do report it, sometimes things don't get followed up on. And for employers, it was all about following up on the reports, valuing staff, and also putting into practice the organisational positions like zero tolerance. So not just articulating it, but really walking the talk. So all of this research then fed into the campaign model. So the objectives campaign are all about increasing awareness, and that's about the fact that OVA against healthcare workers happens, and this is really aimed at the general community, so the public, who don't recognise the extent of what the issue is or the problem is at the moment. Then it's about changing attitudes so that it's not seen as part of the job, and this is for everyone, from the general community, healthcare workers and employers. We need to see a shift in the sector and also in the general community about that. And finally, it's about generating action. The end goal is really behaviour change. And in a nutshell, the aim is we want the community to stop the behaviour, we want workers to report it, and we want employers to prevent it. So, we need to take them through. So we're going to show you the ads now.
I work in aged care to give elderly people the care, emotional support and companionship they need. I care for your loved ones, your mothers, fathers, husbands, wives and grandparents. And this is how you treat me?
Up to 95% of our healthcare workers have experienced verbal or physical assault. No matter what the situation, it's never okay.
So here's the nurse one.
I'm here to help when you need it most. Coordinating your care, listening to and supporting you and your loved ones through your recovery. And this is how you treat me?
Up to 95% of our healthcare workers have experienced verbal or physical assault. No matter what the situation, it's never okay.
And the last one is the paramedic.
As a paramedic, I help in life-threatening situations.
Seizures, drownings, babies on the way, or who've stopped breathing. It's my passion. In an emergency, I'm here for you. And this is how you treat me.
Up to 95% of our healthcare workers have experienced verbal or physical assault. No matter what the situation, it's never okay.
So, pretty powerful message there, and as you can see, it represents the spectrum of behaviour we're talking about. So we're pretty proud of it, as I said. The campaign's going to run until the end of July, and then we'll run some more. It will be evaluated, and then we'll run some more bursts in the next financial year. What on this slide here just shows some of the still images that are going to be part of billboards and on posters, so the outdoor advertising and posters, and we've also got some radio. Janelle's going to take you through a little bit more around some of the more detailed campaign materials from now.
Okay, so all the ads and campaign materials were tested with focus groups. So the focus groups included workers, so paramedics, nurses, aged care workers, and we had two groups of the public. So they were given a question and divided up into groups that were perhaps more likely to commit OVA and less likely, so that we could get the range of perspectives. So they were that involved independent scoring and then further discussions and feedback about the campaign materials. And particularly, I guess, what was noted in that feedback was, I guess, that they all scored, the average scores were 9 out of 10 for all of the objectives. So those were around increasing awareness, increasing the belief that it's not part of the job, and also the belief that extremes, acts of violence, as well as those yelling and threatening and more aggressive forms are all unacceptable. Some of their key comments that were made, and I guess that's something that we hadn't specifically put in, but certainly wanted as part of the campaign, was them to pull away the message of respect, and that was really discussed in these focus groups, that they acknowledged that they needed to have respect for healthcare workers, and also they were thinking about if they were there with family members, that they would keep that. They felt that they would keep that in mind, and it would make a difference if they were to step in and help moderate their family members' behaviour. So the different media channels, so no doubt you may have seen it already on TV. It'll be in Metro and Regional and all the different channels. Regional cinema, it'll be on radio, it'll be on bus panels and train stops, on the sides of buses, and also online. And there's a part of that as well where if people are using social media within a hospital, then it's more likely to come up as well. So really making that connection. So resources that are available to support this is, you will have received emails last week when it was launched, and the hard copy packs are currently being sent, and you've got some materials today in your show bags. But that will include a guide on what to do next, some brochures on the key messages around the campaign, a case study booklet which shows a few of the different things that are happening across different health services and aged care, and posters for staff as well as posters for community, and I'll go through those in a second, as well as Organisational Response Framework, which is the new framework that's been released last week with the department, and also a presentation template, so it helps you to do some awareness raising. You can just add in your specifics for your health service and raise that with your staff. So the staff posters, you've got some of those in your bags today, and there's a spot down the bottom as well so that you can put how to actually report in your individual health service. The wording down the bottom is quite small, so that reads up to 95% of our healthcare workers have experienced verbal or physical assault, but these incidents are currently chronically underreported. Aggression and violence is never okay. Report it to your employer so together we can work towards reducing these incidents and stop it happening to you and your colleagues again. And then there's a box for your individual process. The brochure and case studies, they're just some examples of what has happened around a number of health services, and some contact details also to get in touch with those health services. And WorkSafe have updated their guidance, so their key guidance has been refreshed, and there's a link on the campaign website to get you to that. It's not in your packs today, it's quite a bulky, chunky, lots of good juicy material in there, so you can click on that in the link. And the communications toolkit you'll find on the website the campaign website, and you can click on those. It's got your email signature, it's got your newsletter articles ready to go, it's got your PowerPoint templates and all your creative elements, so your images that you can use, and you can use those specifically for your health service. So have your comms teams look at those. And campaign website, you can actually, there's a little spot there that you can actually download further copies, so you will get a pack which has the copies, but if you'd like to order some more, there is a spot to order those as well. So that's more posters and brochures. So next steps. So I guess the key things we'd like you to take out of the campaign and to really make the most of it within your local health service is, I guess, as boards, to understand your local risks and trends, ensure that reporting occurs and that you know about it at board level. The mechanisms for consulting with your workforce are in place, and that when you've identified those risks, that a risk management approach is used to act on those issues with intending to aim to prevent those. As CEOs, It's a great opportunity to encourage incident reporting, creating a culture that values investigation, learns and feeds back to staff so that it's further reinforcing reporting and the benefits of reporting to actually understand your risks even further and have the opportunity to come up with greater ideas and strategies to prevent. Conducting awareness raising events, so you've got the template for the PowerPoint, you can use those and use all the materials and talking to your teams. The framework, which Denise will talk about shortly, so have a look at that. That's a really good opportunity to look at what gaps there might be. And really make a commitment to taking action to prevent it, manage it and also respond to it. Any questions for us?
Thanks, Janelle. Patrice, does anybody have any questions of Janelle and Patrice? How many of you have seen the campaign? Yes, we have a question over there. Put your hand up first if you've seen any of the ads to date. Good, okay, thanks. Over to you for your question. There's a microphone behind you, and if you would like to just introduce yourself, that'd be appreciated.
Mary Wheeler from Bass Coast Health. I'm just interested in the role of the whistleblower process in healthcare services and how, if you found this is being used by staff, or if it's chronically underreported, it suggests that it's not being very actively used as a resource for staff.
So that didn't come up specifically in some of the research, but the findings around the research was that the staff felt like if they didn't hear back about reports and they weren't able to visibly see what happens when people do report, that they were less inclined to report and didn't feel like there was any purpose to it, and acknowledging also the system and the difficulties of, I guess, the incident reporting system and the length of time to do that. They really felt that because they didn't see anything come of it, that was a factor, one of the factors, as well as the system, in not reporting. And so that's really about, I think that's where we were looking at, really around that culture of supporting and feeding back and involving the staff to actually show that there is action being taken from the reports to reinforce that. Yeah.
Thanks, Janelle. Thanks for the question. Any other questions? I have just one question about evaluation. Is there a plan to evaluate the outcomes of the campaign? Patrice?
Yes, with all WorkSafe campaigns, we do a full evaluation of the effectiveness of it, and we will include in this evaluation evaluating the collaboration as well. And so I think the outcomes of that evaluation won't be available till sort of November, because we've got to see how it runs, evaluate how it worked. There's all the social media evaluation that happens around it as well. So I think November we'll get the evaluation, and then we will, after that, determine what we then do with it. Yeah.
Thank you. And George, there's a microphone there for you. Thank you.
George Brakeberg from Bowen Health. With the focus groups, did you include medical staff, allied health, clerical staff as well? And did you find any differences between the craft groups in terms of their responses?
So there was a range represented in the focus groups, but then also our stakeholder groups that we went to, and using the Violence in Healthcare reference group also gave us the different connections. So it was used in probably a number of different ways. And the responses were really pretty consistent around it. Probably the experiences were a little bit different around, the eye rolling and the yelling and the experience of that versus the physical. But essentially the messages were fairly similar. Yeah.
And I'll just make one other comment about that, about recognising that it's not just the clinical staff that are exposed to this, and they're not just part of the solution either. So everyone that is exposed to patients or patient's family can actually either help with the solution or aggravate the problem or be exposed to it. So we are actually including that in all the work.
Thank you. And I think we have perhaps one last question over here. Thank you.
Yep, my question is just about staff training. You've put out the guidelines around that. Will there also be some guidance around who are providers that are providing training to meet those guidelines?
Do you know?
I might leave that for Denise because she's going to talk about the broader Department of Health work. I'll just do a nice handball there. Next. So, yeah, there will be some info on further training and also some further resources around that. Yeah.
Fantastic. Okay, I think we might just bring that session to a close, but we'll be hearing shortly from the department about the broader strategy. So can you please thank Patrice and Janelle for that presentation? And I know we'll all look forward to that campaign and wish you well with wish you a lot of success in it. So we are going to move on to hear from the Department of Health and Human Services about their strategy and action plan. And we'll be hearing from Denise Ferrier, who's the Acting Director of Policy and Planning, from the Health Service Policy and Commissioning Unit of the Department of Health and Human Services. That's a long title. Over to you, Denise. Thanks very much for coming. Yes, do that.
That's right, Denise. Yes, I noticed that. Good on you.
My work-safe colleagues in the room, so, you know, health and safety is important. Thank you for the introduction, Heather. For people who don't know me, I am the Acting Director of Policy and Planning, and that branch actually looks after the worker health and wellbeing piece of work that's happening in the team. So firstly, I'd like to also pay my respects to traditional owners of the land and elders past and present. I'd also like to thank the team, and that is broadly the WorkSafe and my team, for putting today on, and for people who don't also know that we have another staff forum on the 30th of this month, and I expect the room will be a much bigger room because I think we've got over 300 people attending. So it's been a massive effort from the team, and I'd like to just acknowledge them first. I think my job today really is to tell you a little bit about kind of what we have planned as a department and what is already happening in this space. So you saw just a minute ago around the campaign, and that has been a long process in terms of getting things done, and it has been a very collaborative approach with WorkSafe. And we are continuing really that collaboration with our partners, both in WorkSafe and in our kind of stakeholder groups, through the development of our next lot of materials. So today I've really been asked to cover off some of what those key elements are and a little bit of history around where we've sort of come from in terms of the reviews that have happened to date, and also the task force work that has informed our directions going forward. There is a clicker somewhere. Push somewhere, there you go. Terrific. So really the area of occupational violence and aggression is not something that we don't know the issues about. It has been a well-reviewed area, and a number of recommendations have been made in the past. I was at a roundtable with the Minister on Friday, and I think someone from ANMF actually flagged that the first review that they could remember was in 2005. So it has been well-reviewed area and lots of recommendations made. So that's the first thing to say. So I don't think we need to cover off too much around what do we know about the issues, because I think we do know them pretty well. But actually, what's important about all of those recommendations and reviews are the findings of those reviews, is that there's some common themes throughout them. The first is that no one action will solve the problem. So I think that's a really important aspect of the strategy that we've tried to take on board going forward, is that it's not a one solution fix. We need to be doing things in collaboration with others, and we also need to be having a multifaceted approach. The other thing that's common to all the reviews is leadership and accountability. It really is an important message to make sure that we are understanding that as leaders in our organisations, it's our job to do something different and to make sure that we are actually driving the change we want to see. The third thing that came through all the reviews is that culture, and as Claire said earlier, culture and culture change is the key element here in terms of underpinning the way forward. We need to make sure that that culture is actually about not accepting occupational violence and aggression in our workplace. Training and support at all levels and tailored for all needs is also another recommendation that comes through very strongly in all of the reviews. Again, training, and I'll go to the point made just before, is that training actually is key, but it needs to be localised and it needs to be understood that in order to get the best action, you need to do it in a tailored way. Reporting culture. I don't need to say very much more about that. I think we've covered it. And public awareness raising. And again, you've just seen this morning the campaign that we have in place at the moment. So the findings, I think, are pretty key in terms of the way our strategy has been developed. The other key point there is around collaboration. So again, this is not something that you can do on your own. It's not something the department can do on its own, and it's certainly not something that WorkSafe can do on its own. So we need all the key players sitting around the table and working this out, and we absolutely need to learn from each other and how to do it better. So I do just want to recognise the Violence in Healthcare Task Force and the work that that group had done for us in 2015. The Minister established the task force and Claire chaired it, so thank you, Claire. But really, again, the key findings from the task force were that without culture change, we were really on a path of actually just finding single solutions. We needed to go to the underpinning symptoms, and we need to try and make sure that we reset the culture as we go forward. The task force agreed really that the key things that we needed to focus on in terms of building culture were around awareness raising, improving reporting, providing a more consistent approach across the sector. So there was great work in lots of pockets, but not consistently being seen across the sector, and to support that, a better understanding and sharing of best practice. So they were really the key findings come out of the task force that would help us support a resetting of the culture as we move forward. So the department have, in the couple of years since the task force report was released, really thought through how we might actually support people moving forward in their organisations. And the first of the resources that was published was this thing that you can't read, and I certainly can't read over on that screen without my glasses on, but was really just a sort of a one-pager, which was really about flagging the things that we thought were important in terms of the culture change that was needed, and recognising that in order to achieve culture change, we really needed to lift the level of awareness across the organisation. We needed to engage at all levels in the organisation and across the sector. We needed to build some knowledge and competencies across our understanding of what occupational violence and aggression was, and what the symptoms of it are, and what drives it, and how we respond to it, and what do we do about it. We needed to start to build a leadership culture that was strong and recognising the importance of it, and we needed to put in place some clear accountabilities for outcomes. So our strategy really details that everyone must be involved. It's not an issue for one part of the system, and it's certainly not an issue for one part of your service. It is something that touches every part of your service, and it certainly touches all parts of the sector. The strategy focuses on increasing the public awareness, public reporting and shared learning, builds knowledge and capability through providing better guidance and consistent training, and we must respond and take action to create safe environments by increasing the accountability for the actions at all levels of the organisations. Our aim in the strategy is to really make sure that everyone feels supported, to report incidents and provide feedback, to make sure that what we do is take learnings from those incidents and understand how we put in place better controls and preventive strategies going forward. And as health service boards and management, we want you to be informed about the risks that are occurring in your organisation, and then for you to take action to respond and prevent incidents going forward. So we've been working on an approach that is really about 8 platforms of action. Those platforms are around governance, improving practice and preventing risk, education and training, facility design, we believe that's a key part here, community awareness, as you've seen this morning, trying to improve reporting and reporting culture, focusing on security responses, and our post-incident response and support services. To deliver against all of those key actions, though, we can't, as I said before, take them one at a time, and we certainly can't take them from only a single focus. So we've been also thinking about how we do these strategies going forward across across the continuum of prevention, early intervention, management and response. Again, not sure you can read that, I certainly can't from over there, but this is our kind of summary, if you like, of our multifaceted approach to implementation as we stand today. With the assistance of the Occupational Violence Reference Group, which has already been mentioned this morning, we've been really working on trying to think through how we tackle each of those 8 platforms across each of those levels of continuum, from prevention right through to kind of management and response. So some of the things that have been put in place already include the introduction of requirements for boards and hospital management to publicly report incidents of occupational violence and aggression. We've been supporting evidence-based policy development, such as through the behavioural assessment guidelines that were released recently and soon to be released body-worn cameras policy. We've also been developing consistent policy guidance around Code Grey and Code Black responses and revising our Code Grey standards. A key point for us is also thinking about our training and also making sure that we have a consistency of the degree of training that operates across the system. We can't deliver that training as the department. What we can do is offer it up to the market and offer it up to the different parts of the system to be able to support each other. What we wanted to do, and the advice that we were asked to provide, was around minimum standards. And how do you evaluate the quality of the training that you are bringing into your organisation? So minimum standards for occupational violence and aggression training will soon be released, and further development is actually happening on training resources and tools, such as an evaluation framework, and also some scenario-based training modules that we'll be able to roll out. Of course, Safe Wards in our mental health setting is also a program that is being rolled out. Other examples of work that we're doing at the moment in terms of particularly around security of facilities include our Health Service Violence Prevention Fund, and people will be aware of the government's most recent commitment to double that fund over the next few years to ensure that we are supporting health services in their facility improvements to prevent and manage the risk of occupational violence and aggression. There are also commitments to establishing more behavioural assessment rooms across the state. We've also been responding to the need really to include greater consultation in the way that facilities are designed. So putting people who are in the front line actually in the design process, and our capital people have been working hard to ensure that that happens. We're providing additional resources as well, most recently announced by the Minister on Friday, I think, around security responses. So firstly, we will audit our current security staff models, and I think people will be aware that there is no one security model that works for everyone. And we, in fact, when we've done the scan of literature and research across both national and international standards, there is no one size fits all for security models, very dependent on your current circumstances and situations, your geography and your workforce. So we're looking at auditing the current models that are operating in Victoria and trying to develop really guidance for every health service at all different levels around how they best employ security models for the future. We will also be boosting our security personnel at hospitals, particularly in hotspots across the state. Reporting has been touched on, and people will be aware of the work that is happening in the VIMS space in terms of our incident reporting. And we are keen and committed as a department to ensure that we are simplifying our reporting processes going forward. We are also keen and committed to supporting you and your services to respond to the incidents that do occur in your service. And we have currently commissioned an expert review on the recommendations of the previous nursing task force and the organisation-wide responses to occupational violence and aggression. And today I'm just going to touch on the framework that has been developed to support organisations do their assessment of their capability in that space. So the framework that we are releasing and is in the packs, and I'm just looking at Janelle as she nods, is the one-pager. Looks a little bit like a green sheet. Hopefully it might be big enough for you to read. If not, download it in A3 size. But that framework really is about a tool or a guide for health services in terms of their management and boards to understand the range of risks that you need to consider as you're working through preventing and managing occupational violence and aggression in your service. We commissioned a review of the evidence around the management of occupational violence and aggression and an independent review of the responses last year, as I said. We had consultants visit a range of health services and look at the organisational approach that was in place for preventing and managing the risks of OVA. While there was excellent examples of good work being done, we thought we needed to share those, and we've developed the framework really to help you understand what you can do in your service. The Occupational Violence Reference Group were our sort of key touch point in terms of the development of the framework, and they've provided great advice around how we can actually develop the principles and the key components so that it can be used as a sort of ready reckoner or a tool on an easy to sort of read one-pager that will outline the key components organisations need to have in place to address occupational violence and aggression effectively. The framework covers the areas of governance, prevention, training, response, reporting and investigation. Its aim really is to be used as a gap analysis, so if you actually use it as a tool to understand where your service sits in terms of its ability to respond to the current situations that you might be facing. It should also help guide your implementation plan. Where are your strong points, where are your weaknesses, and what do you need to do to rectify those? The framework will be supported in the coming sort of weeks and months with more detailed documentation that will include findings from the literature review and the examples that you could apply to your health service in terms of the responses. I encourage you to look to how your organisation fits within the framework and identify what might need to be strengthened and where you are doing well, and consider what good practice that you could have already in your organisation that could be shared. And I will encourage you to think about using our worker wellbeing website and the occupational violence components of that to be able to share some of that good practice. The framework, as I said, is available on all good websites near you, and I think that's on my next slide. There you go. Again, if you can read it, hopefully you can. It's the Worker Health and Wellbeing website that's on the Department of Health. And of course, the team are always available to talk you through the resources as they become more available and what you might be able to do in your organisation. So I would encourage you to look at the tools that are being made available to you. As I said, we've got a rolling program in the department to continue to develop the resources and supports that you can use as management and boards to help you approach your particular risks in your service. And we will continue to roll that out over the next sort of 6 to 12 months, hopefully, and then review as we go what's being used and what's being effective. So thank you for your time, and I hope the rest of the forum is effective and useful for you. Thanks.
Thank you, Denise, very much. I think we're inviting our rural and regional people to submit questions. Do we have any questions from them? Not yet. So they might want to think about that after morning tea. We might skip questions at this point from the group here because we're running a little bit close to time. Allow you to break for morning tea. Denise, I think, will be here for morning tea, so you can further explore that very comprehensive work that she and her colleagues from within the department and other agencies have been undertaking. So there's a lot of support there for you. So take the opportunity to discuss that further over morning tea with your colleagues and with Denise. So thank you, Denise, very much for a very comprehensive presentation and a lot of work underpinning it. We're going to break for morning tea and come back at 11:15. Our morning tea's out the door there. The rural and regional people might have something a bit more local. We'll see you all back at 11:15. Thank you.